As part of the HALCyon collaboration, we're interested in thinking skills, sometimes called cognitive functions. These are things like memory, reasoning, processing speed, and visualizing things in 2 and 3 dimensions. Thinking skills are part of health, and health affects thinking skills. And it was a good opportunity to bring together various cohorts that had collected both health and thinking skills as part of their data collection. Being better at some of these thinking skills makes you more independent as you grow older, and also better thinking skills are associated with quality of life and even how long people live. So it was important to try and bring some of these together and analyse them in the context of health and well-being. Now, in the HALCyon collaboration, we're especially focusing on what's called normal cognitive aging, or the normal aging of thinking skills. We're not studying the end, which is called dementia, or even the milder form, which is called mild cognitive impairment. There are actually about 750,000 people in the United Kingdom just now suffering from dementia. We think it's very important to study the earlier stages of cognitive decline, because that's probably the time when you can actually find the variables that will help you to intervene and actually make things better before people reach the stages where they have got more severe degrees of cognitive impairment. So what we're interested in is studying the factors that build up as much cognitive ability as we can during our life course, from childhood through adulthood into old age, and also studying those factors which push people down in old age or even keep them strong in thinking skills in old age. And this is sometimes called cognitive reserve. We're trying to find out the factors that help people build up as much of this cognitive reserve as possible, keep their thinking skills strong so that they'll deteriorate less in old age.
Well, first, we want to identify the most important life course influences on cognitive capability as we age. But since most of what we know comes from single cohort studies, we also want to look at those influences across all of the cohorts in the HALCyon program. So, for example, conditions in 1918, when the oldest of the HALCyon cohort members were born, were very different to those 40 years later when the youngest of the cohort members were born. And so were the life chances of men and women in those different times. Does that make a difference to cognitive capability? And second, we're very interested in how cognitive capability relates to physical capability and mental well-being. Do these decline in parallel as we get older, or are there circumstances under which one of these functions declines while the other is well preserved?
We've already conducted a couple of studies in the HALCyon collaboration looking at the factors that affect cognitive change or change in thinking skills over time. So, for example, in collaboration with Work Package 2, Wellbeing, we've looked at the association between depression and thinking skills over time in the English longitudinal study of aging, and found that people with low mood at the beginning of being measured several times tend to dip more in their thinking skills. And this is studying people between 50 and about 90 over a period of 4 years. The other thing we've looked at as well is an interesting question, actually asking whether people who start off with higher levels of thinking skills have a less steep decline as they grow older. And this is sometimes phrased as the question, is age kinder to those who are initially more able? And interestingly, looking at 2 cohorts, the 1946 birth cohort and one of the Lothian birth cohorts from Edinburgh, we found 2 different answers. We found that childhood intelligence up to middle age in the 1946 cohort, it is true that age is kinder to those who are initially more able. People declined less in their cognitive functions between their 40s and their 50s if they started higher with better thinking skills. We found no evidence of this at all in the Lothian cohorts. That's something we'll be looking at a bit more subsequent research.
Well, first of all, we want to test the long-term effect of early social circumstances on cognitive capability, and also looking at important links in that chain like education and health. And second, we want to test the extent to which physical capability and cognitive capability decline as we get older. and whether there are any circumstances under which one is preserved while the other declines. We're keen on having an impact in two particular ways. First of all, if childhood cognitive capability is found to have an impact on adult cognitive and physical capability, that's an important message to get across to people who are in the front line of child development, including parents and teachers. And second, we want to share knowledge with survey members themselves and also the wider public about the things we can all do to control things over most of our lives that will protect cognitive capability as we grow older. For example, diet, where there's a lot of confusion over what's healthy and what isn't, and physical exercise. And then when we do this, it's just as important for people to have the big picture, which is important for us to get across negative findings as it is to emphasize positive findings. And of course, we need to get across if we find anything that might be harmful to cognition.